Welcome, everybody, to the Institute for Work and Health speaker series. My name is Monique Gignac. I'm a scientific director and a senior scientist at the Institute. Very glad that so many of you are able to join us today. Before I introduce our speaker, Dr. Peter Smith, I'd like to just run through a couple of housekeeping items with you. First of all, we are recording the session and the slides will be made available. They will be ready in about a week, and so you can get access to them then. In terms of asking questions and sharing your comments, hope you will. We ask that you type them into the question and answer box. So the chat is disabled. At the bottom of your screen, you will find a Q&A box, and you can type your questions in there. If you are interested in activating the closed captioning, you will also find that at the bottom of the screen under the More button, and you can set that up for yourself. We actually have a very large number of people who have signed up and possibly will exceed our Zoom webinar numbers. And so anyone who does come in, after I think about 500 people, you're going to be diverted to our YouTube channel. So I hope that you will be able to join us through that. And unfortunately, the one challenge there is that it won't allow you to ask any questions during the seminar today. So if you do have questions for Peter, please do send them to him after the talk. And he will have his slide with his email address, psmith@iwh.on.ca, on his last slide, and you can send your questions to him later. Okay, I'll repeat some of the question and answer kind of housekeeping as we get to the end of the presentation, but let me introduce Peter to you. Dr. Peter Smith is the president and senior scientist at the Institute for Work and Health in Toronto. He is also a professor in the Department of Epidemiology at the Dalla Lana School of Public Health at the University of Toronto. His major research interests include examining how working conditions, in particular the psychosocial work environment, impact health. He is also interested in developing methods to integrate concepts of gender and sex into secondary data analyses and understanding how changes in the nature and availability of work in the Canadian labor market impact different approaches to the primary and secondary prevention of work-related injury and illness. Today, he's going to talk about system-level approaches to prevent and manage psychological injuries in Canada and Australia. Welcome, Peter, and over to you.
Thank you very much, Monique, and thank you everyone who's joined us today for this presentation. I'd just like to acknowledge the research team involved in this project, the funding for the project funding, which came from the Workers' Compensation Board of Manitoba, and of course, that the work that the Institute does, activities like this, our dissemination and KTE program and our scientific staff can only operate with the support of the province of Ontario, which we're very grateful for. So just a little bit of background about why we were interested in this particular topic at the Institute for Work and Health. There is, I think, increasing recognition of psychological injuries outside of post-traumatic stress, which have been covered by workers' compensation systems for a number of years, and more recently that's been broadened to chronic mental stress. Jurisdictions that have compensated psychological injuries have noted that these injuries tend to have longer durations, greater healthcare costs, more challenges in the return to work process, and increasingly different either from the prevention side or from the management side. There are different initiatives being put in place, changes to legislation, changes to system-level initiatives, things that workplaces are doing to try to reduce the impact, either to reduce the occurrence of psychological injuries or to reduce the healthcare costs and wage replacement after those injuries occur. And although this is happening across a variety of different jurisdictions and across a variety of countries, a comparison of the similarities and the differences in legislation and the regulations and the impacts in particular of particular changes in one jurisdiction that may not have occurred in another, there isn't a lot of a good understanding of what the differences are and how they've impacted either the prevention or the management of psychological injuries. So in this project, one of the things we wanted to do was to better understand the extent to which different jurisdictions in Canada and in Australia were including different types of psychological injuries, the strategies they were using, both from an OHS prevention and from a workers' compensation system side, to address either psychosocial exposures in the workplace or to address challenges in return to work after injuries occur. And through a series of interviews, if people could tell us a little bit about what they saw as the benefits or the challenges with particular approaches, and better understand the measurable outcomes that people were using to understand if particular approaches were working. So in terms of the methods and the data collection, we did what we have termed a modified environmental scan. First of all, we reviewed all the health and safety and workers' compensation legislation in the 14 Canadian and 9 Australian jurisdictions, as well as guidance materials that were available in those jurisdictions. And then we conducted interviews with 32 different experts across 16 different jurisdictions to better sort of flesh out, one, if our review of the system, the legislation, the guidance material within their jurisdiction was accurate, and also to better understand the strategies that have been implemented that maybe aren't publicly reported on, and how they, I guess, their perspectives on what strategies are the most effective in reducing the impact of psychological injuries and how they know that. Those interviews, we did 13 different interviews across 12 different jurisdictions in Canada and 8 interviews across 4 jurisdictions in Australia. And so the key findings in terms of what we found out when we combined the information we collected as part of the scans and as part of the key informant interviews. One, approaches vary a lot across different jurisdictions. That variation is a lot greater across Canadian jurisdictions than it is across Australian jurisdictions. And I'll talk a little bit more about why that is the case as I get into the presentation. Many jurisdictions are providing guidance, either guidance around the prevention of psychological injuries in the workplace or addressing psychosocial risk factors, or providing guidance around differences or how to manage these types of injuries and return to work. But there was a lot of difference that we noted in terms of the scope of that guidance and the level of detail that was being provided. Prevention strategies are really shifting from what would be a sort of a very individual level focus about building resilience to a much greater focus on the organisation and organisational readiness. Claims management processes are adapting to better understand particular challenges that might arise with psychological injuries compared to injuries that have traditionally been compensated under most workers' compensation system, which are more physical in nature, but there are some challenges that remain. Often there was a talk around the importance of collaboration, whether that be collaboration at a system level, collaboration in terms of the stakeholders involved in return to work, but this wasn't always easy to do, and there had been varying successes across the different jurisdictions, and measuring the impact of what we're doing remains a real challenge. I'm going to now go through each of these 6 main findings in a little bit more detail and tell you, again, embed some IWH research along the way and sort of talk about some practical considerations. You may notice already as I've sort of gone through the presentation that I talk about psychological injuries and I talk about psychosocial factors in the workplace, and they are different. A psychological injury is generally one where the primary condition is mental health related. Psychosocial factors, which do affect psychological injuries or the risk of psychological injuries, are factors, hazards in the workplace that can be assessed. So in terms of the first point, approaches vary across jurisdiction. So in particular among Canada, there is still some variations in terms of what types of conditions are being covered. There is one Canadian province that only covers post-traumatic stress conditions. Most others cover chronic stress, but there is sort of variation around how that is diagnosed and how it is adjudicated. Again, within different jurisdictions, sometimes there's a split system like we have in Ontario, where we have one organisation, which is the Ontario Ministry of Labour, Immigration, Training and Skills Development, which is focused on prevention, and a second organisation, which is the Workplace Safety and Insurance Board, which is focused on the management of psychological injuries. In some jurisdictions, these functions are combined. In others, they're separated. And so that can create particular challenges within collaboration across jurisdictions where that occurs. Australia has done a lot of work to overcome some of the challenges around interjurisdictional variation. So Safe Work Australia has developed a national code of practice, which has been adopted by each state in Australia, state and territory. So the legislation in all Australian states and territory now either includes that an employer must assess and take reasonable steps to address psychosocial and psychological hazards, or makes it very clear that the duty of care includes both physical and mental or psychological health. I'll talk about why potentially getting employers to focus on psychosocial hazards might be a more feasible approach as I get later into the presentation. But this idea about trying to understand or trying to encourage organisations to take a dual approach to both physical hazards and psychosocial hazards makes a lot of sense and is backed up by work we've done here at the Institute for Work and Health. So this is a paper that was recently published in the American Journal of Industrial Medicine. The blue bars here represent the prevalence of a physical injury in the last 12 months. The red bars represent the prevalence of a psychological injury in the last 12 months. And we've got a couple of different buckets along the bottom of the graph. On the left-hand side are organisations or respondents where there was good occupational health and safety prevention and good psychological safety prevention as measured by the psychosocial safety climate measure. And on the far right-hand side, you can see organisations where there was a lack of protections around occupational health and safety vulnerability and a lack of protections around the psychosocial safety climate in the organisation. But I want to draw your attention to some of the comparisons. So if you think about these two bars here, these are both organisations where respondents have told us there's a poor occupational health and safety climate in the organisation. But where there's a poor occupational health and safety climate combined with a good psychosocial safety climate, we see an 11% prevalence of physical injuries. Where there's a poor occupational health and safety climate combined with a poor psychosocial safety climate, that doubles to 21%. Similarly, when we focus on psychological injuries, the two bars I'm showing you both have a poor psychosocial safety climate. But when the poor psychosocial safety climate is combined with good occupational health and safety preventions, we see a prevalence of 6% in terms of psychological injuries. When it's combined to a poor occupational health and safety climate, we see that increase almost threefold to 17%. So the take-home message from these slides is focusing on the psychosocial environment not only protects psychological injuries, but physical injuries, and focusing on the physical or occupational health and safety climate not only reduces the risk of physical injury, but also plays a role in psychological injuries. The second point, so most jurisdictions provide guidance, but the guidance does seem to be at very different levels and different scopes and levels of detail. So legislation and guidance materials have been used across all jurisdictions to prevent and manage psychological injuries. Often the context and the extent of guidance tended to reflect what was involved in the legislation. So where the legislation doesn't focus broadly on psychosocial hazards, but might focus on very specific types of conditions such as violence or harassment or bullying, the guidance material tends to focus on just those types of occurrences in the workplace. There was a lot less alignment on guidance material in Canada compared to Australia. So sometimes in Canada, there was a real broad focus around the guidance material that was being provided. Sometimes it was very, very narrow and focused. Often when we conducted the interviews, there was a real challenge at the jurisdictional level about providing sort of very general guidance material between being too prescriptive. And one of the things we heard in particular in Canada around the Canadian standard around psychological health and safety is that often organisations found that overwhelming in terms of its prescriptiveness around, what are the 13 factors and how they should be measured. Whereas in Australia, they were moving generally towards more more sort of general material about building employer capacity. Jurisdictions, some of them offered advisory and consultative services to help put the guidance into practice. A lot of the time, the uptake of that was really only done, it wasn't done in a very proactive sense, but it was much more reactive, as in, we've noticed this is a problem, we've got a lot of these injuries occurring, now can you help us try to put some guidance into place? So some practical considerations that we heard about in terms of the interview. In Australia, there was a lot of talk about really directing employers to focus a lot more on reducing psychosocial risks in the workplace or improving psychosocial safety in the workplace, instead of asking them to focus on mental health. And the reason was because often an employer, if they're asked to focus on mental health, they start thinking very broadly around mental health. They start thinking about the factors outside of the workplace that could impact mental health, and asking them to say, well, we're not asking you to make everyone happy or address things that are occurring outside of the workplace, but we are asking you to ensure that the workplace doesn't exacerbate those types of issues that are occurring outside of the workplace or generate new symptoms or new mental health conditions by not addressing psychosocial factors. And they are under your duties of responsibilities. There was a perceived need. So often with general guidance, there was challenges when talking to specific injury groups that it wasn't bespoke enough. There was also a need to try to have material that could address the different places in a journey where a workplace might have been on in terms of addressing both psychosocial risk or psychological injury. So sometimes the employer is just starting, it needs to know what's the first thing I need to do. Other times where they're sort of further along the journey, there needs to be a more detailed knowledge, and trying to find that balance is a challenge, and where to look for that on the websites was also a challenge. Organisations talked about, talked about industry-specific resources above, and also workplace-specific. So things directly for smaller businesses compared to larger organisations. These in our interviews were identified as being really useful. So trying to identify these case studies, which are sort of best practice, which demonstrates that doing something to address this can both be feasible and be effective, and having what we would traditionally call educational influentials. So these are people that have a practice orientation, but people look to for advice on how they might start addressing psychosocial factors, or how they might address some of the challenges around psychological injuries. Identifying people within the industry or in similar types of workplaces to do that messaging is an important thing to address. So here's an example of a pretty general approach. There's one that not just Safe Work Australia commented on, but also one that a lot of other jurisdictions commented on as being something that they liked. So Safe Work Australia on their website has a pretty straightforward approach to, sort of general approach to, if you want to manage psychosocial hazards and risks. And so note here, this focus on psychosocial hazards and risks, not on employee mental health. So here's the 4 steps. So they just say, step 1, just straightforward, identify the risks, assess how often the risk occurs and how it impacts worker health, do something to control the risks, and then review the control measures. And then within each of these steps, an employer or someone else can break them down. And again, the guidance is very straightforward, very general. So you want to identify the risks. Nothing prescriptive here. So this is just about consulting with your workers, trying to understand what the different hazards are, what they might be exposed to, and giving options. You could do it in a couple of ways. You could do face-to-face discussions. You could analyze some of the survey data. You could collect that and analyze it if you want. You could do some direct observation, walking around the workplace. You could analyze data, if you're collecting that sort of information, but giving an employer a lot of latitude about where to start, not being overly prescriptive, and trying not to overwhelm an employer who, in good faith, wants to take the first steps on trying to do something in this area. So point 3, prevention strategies are shifting towards an organisational focus and moving away from an individual level focus. And this is also backed up by research. So increasingly, jurisdictions aren't offering, how to build employee resilience, aren't offering things around, these types of very individual focused interventions, and moving much more towards what can you do at an organisational level about the structure of work, around the way work is organised, to address psychosocial factors. This is particularly prominent in Australian jurisdictions, where they focus a lot on management commitment and worker participation as being key pillars to successful prevention efforts. So again, here's some guidance material from Safe Work Australia on managing psychosocial hazards in the workplace. You see that same sort of identify, assess, control, review, which is, again, this is the same approach you would take if you're addressing physical risks in the workplace as well, which is another reason why you might want to have a dual approach. But the key here is at the center of this approach is management commitment. So you need to have management commitment in order for this to be effective, and worker consultation is what sort of surrounds it and holds the approach together. And again, this is backed up by research. This is not research from the Institute for Work and Health, but it's research that was published in the Scandinavian Journal of the Work Environment and Health, which did a review of reviews. So covered, I think it was around over 900 different studies. And in this particular review, one of the more interesting findings was that it found that the same intervention was sometimes effective in one study and then sometimes not effective in another study. And this team went back to the primary studies and tried to better understand, why does an intervention work in one setting but not work in another setting? And this is a quote, I've underlined it here, which I think are the important parts. This is a direct quote from the discussion in this paper, that it says the success of these interventions depend a lot on sufficient and continuous management support, appropriate problem assessment, which is around how do you collecting data, what are you collecting, ensuring the intervention fits the problems to be solved, and the active involvement of employees. So again, research evidence backs up that there's no point doing steps to address the psychosocial work environment unless you've already got management commitment and unless you've got a process to involve employees in that activity. And again, some recent IWH work. This is a paper which is currently in press at the Journal of Occupation and Environmental Medicine. And this talks to the point of why you need to address the broader environment before you start to address some of the more specific aspects of the environment. So this is a study which we collected information in British Columbia. We've got groups of the psychosocial safety climate. On the left is the group where there's a high risk. High risk is assessed by the PSC-12, which is the Psychosocial Safety Climate 12-item measure, addressing management commitment, worker participation, employee communication. And on the right-hand side of this slide is a low risk, so employees in a good psychosocial safety climate. And you can see in this slide that the effects of workplace mental health stigma, so this is how employees feel like they can talk or how people with mental health are treated in the workplace, and how that's related to psychological distress. The effects of mental health stigma on psychological distress are stronger when the psychosocial safety climate hasn't been taken care of. So by addressing the psychosocial safety climate enables you to be more effective in addressing other things that are occurring in the workplace, such as mental health stigma. So getting management commitment, employee communication and participation, getting those pillars right up front enables you to go on and address other factors in the workplace. Claims management processes are adapting to better support workers, but there are some challenges that remain. So we did hear a lot from jurisdictions talking about how psychological injuries and even the inspections for psychosocial hazards in the workplace does require some different types of skills in terms of either from a claims management perspective or from a workplace inspector perspective. So often when jurisdictions were covering psychological injuries, they had smaller claim loads for these claims management. They had a lot of trauma-informed training. So often the adjudication process for physical injuries, goes about, you're really trying to understand what the process, what happened, how, when did it first start. You need to be very careful around psychological injuries to reduce the risk of re-traumatization. And so really having very trauma-informed training, often only having conversations about those really specific aspects if there's a mental health provider in the room for those conversations, and also supporting the management staff. Like hearing about some of these issues can be really also traumatizing for the people who are trying to adjudicate them. We consistently heard about long adjudication times around challenges accessing treatment. Often this was based on the fact that in a lot of jurisdictions there needs to be a diagnosis for a claim to be accepted. Some jurisdictions had networks to try to expedite claims with particular providers. Sometimes they were providing sort of higher than average compensation, updating their fee schedules to ensure this type of diagnosis could be done as soon as possible. They also, a lot of jurisdictions were doing sort of early intervention, so providing some type of support for workers. It didn't have to be a psychologist or a psychiatrist. It could be a social worker. It could be a counsellor. It was provided at no cost, just while the adjudication process was occurring. So people who were having their claim adjudicated could, access these services. Sometimes it was even extended to their family members, which again is this consistent challenge that people in general find sometimes in the workers' compensation process, is that they're just being treated as a claim, trying to get them back to work and not really thinking about them as a person. And so extending it to family members, because often there can be spillover in terms of the effects of these conditions. We also heard in some jurisdictions, this was in Australia, about how they were really paying attention and being very sensitive to physical claims and developing psychological components over time. In this jurisdiction, they were talking about how they were providing additional training for case managers, and they were actually using a proactive questionnaire to assess pain, to assess sleep, to assess coping among people with physical injuries who had been off work for an extended period of time, and then offering them supports. And you can see here I've got in brackets mental health. These were designed to address the issues around pain, sleep, and coping, which were determined to have a psychological component, but they didn't talk about them as mental health supports. They just said, could we offer you some supports? And in this jurisdiction, they had found that a lot of the time people were really happy to take up that offer of supports and only use them 1 or 2 times, but it was really effective in terms of helping them get back and address the issues around pain, sleep, and coping. So some practical considerations. So providing supports for workers and their families is really can be really beneficial while their claim has been adjudicated. Some jurisdictions were providing access to telecounselling supports while a worker was establishing a permanent healthcare provider to have a conversation with. Different jurisdictions were taking different approaches. In some jurisdictions, they recognised that there were different skills required for people who are navigating client care or navigating eligibility or the case management, and so they had a multi-staff models. Other jurisdictions were talking about how it was really important for people to have a single point of contact that they could talk to around the claim at all times. And so we didn't get a clear sense, but different jurisdictions were using different models. Moving through, so collaboration, I've only got 2 more to go. Collaboration is a key enabler of system effectiveness, but not always easy to do. So most jurisdictions were talking about early engagement, developing a clear understanding of responsibilities at a worker level, at a workplace level, at the healthcare provider level, and at the system level around who's responsible for what. These were key in terms of successful return to work. Employers, people were talking about how employers were discussing often they needed industry bodies who could give them more specific guidance around how to, address legislation or regulations in terms of guidance material. Sometimes these were communities of practice. Sometimes these were injury sort of specific workplace collaborations where there was almost like safety groups, which we have in Ontario, but where work organisations could talk to other organisations who had dealt with these types of activities. At the healthcare provider level, there were efforts to improve capacity around what does good work accommodation look like and what does early and safe return to work look like. And I'll talk about that in a second with around the practical considerations. So some jurisdictions, as I said, were proactively reaching out to employers to offer training and services as part of the claims management process. This can be challenging because you're sort of talking about, if you want to think about it with a sort of a crisis analogy, you're talking to a workplace about the fire hazards or safety procedures they need to put in place while there's a fire actually occurring. So it's often too late at that part to proactively reach out. But you could reach out to organisations which have a large volume of claims and offer them services to try to reduce that volume. This concept of recovery at work. So certainly we heard a lot about how employers were really unsure about what does reasonable and meaningful accommodation look like. A lot of healthcare providers in the psychological injury space were struggling with how do you return someone to work? And they were very hesitant about returning people to work when they weren't 100% recovered. And so trying to navigate that challenge and embedding this concept of recovery at work, which I think we've done a pretty good job in the physical injury space, but doing that in the psychological injury space still has some challenges. And having structured discussions. So there was one jurisdiction which was commenting that they can understand now that sometimes there's a claim and they can just see that the return to work is never going to happen, and trying to identify these situations as early as possible, not waiting for a year for this process to sort of unwind, and then sort of after a year you sort of move on and say, okay, instead of returning to work with your ad injury employer, we'll return you to another one. Identifying the situation early and starting to reconceptualize what's return to work going to look like in this particular situation, and being supportive about that process. And so again, IWH research, this is a little bit older, but this is done in Victoria and Australia. We have identified that when people have psychological injuries, they're less likely to receive a consultative return to work plan. They're sort of less likely to receive any type of plan or guidance material, and they're less likely from their employer to be given a return to work date when they might be able to return to work. So there's a lot more uncertainty about what safe and consultative return to work looks like, and a lot more uncertainty about when people should return to work. I noted this before about often it's too late when you start to focus on managing the illness, because that's trying to put out a fire when you've got no fire safety plan in place already. And this comes back to some work which I was involved with, which was led by Tony Lamontagne at Deakin University, about trying to take an integrated approach. So really trying to start early on preventing harm, thinking about the positive aspects of work as well as managing illness. So workplaces that only focus on managing illness tend to fail because they're not bringing people back into an organisation where they know that harm will be prevented and the workplace is positive. And so this talks about the importance of really taking this integrated approach when it comes to psychological conditions, and not just focusing on managing the illness when it occurs and trying to address the work environment then, because by then it's too late. Measuring impact remains a challenge. So we found very few examples of independent evaluations of strategies. Workers' compensation agencies and prevention agencies were doing some work, so they had a lot of information data they were collecting internally, which was helping them decide on the strategy to take, but often these were pretty small, like numbers of downloads, maybe queries, how queries were changing, uses of materials. Sometimes if they were providing training resources, they were assessing learning and self-efficacy after the training had occurred, but not a lot about what are the changes that actually were occurring in the claim process. Traditional indicators were the ones that were mostly being used to evaluate impacts. So claim volumes, proportions that were psychological, cost per claim, noting that some jurisdictions were aware that they might see with reductions in mental health stigma, addressing or building awareness that psychological injury can be a part of the work process, that claims volumes could increase while claim costs or cost per claim might actually decrease. And so really taking a very measured and informed approach into what each of these different metrics mean. Few jurisdictions were capturing information on worker function or symptom severity at claim submission, but the ones that were seeing this as really important. So trying to encourage people to address mental health stigma, to encourage people to report earlier, noting that when you report earlier, when you're inside the system earlier, strategies can be put in place for early intervention rather than letting these issues build up over time. So here's an example, one of the few we found, which is in Australia, around an intervention program that had been evaluated. So this was funded by iCare, which is a system in New South Wales. And it was run out of the Centre for Transformative Work Design, Curtin University, so a multi-university study. And it was talking about sort of creating smart work design interventions. So this is around preventing psychological injuries in the workplace. And so this is by Sharon Parker's group, and it sort of talks about, things that an organisation might want to do. And so this guidance material was in place, funded by iCare, evaluated by iCare, and sort of shows, a strategy that workplaces might be able to put in place to address psychosocial hazards in their work environment, what they might want to focus on, and what the impacts might be. So overall impacts for policy and practice. So prevention policy and programming should increasingly support building employee capacity and readiness. So having really prescriptive information wasn't seen as overly useful, but trying to build employer capacity and employer readiness about, this is part of your responsibilities. These are the things you can control. This is the type of activities that other similar employees have done in the past. So building that capacity and readiness was seen as really important prior to trying to provide any prescriptive information about you must do this or you must do that. So giving a bit of latitude around, because it is possible. It is possible that every employer, regardless of their size, regardless of their industry, can make steps in this area. Strengthening collaboration and aligning system priorities. So trying to, some of the challenges we noted in some jurisdictions where prevention was in one organisation, compensation was in another. Sometimes there was a disconnect between the prevention activities, the compensation activities, how different workplaces are involved, where workplaces need to look. It is nice for workplaces to sort of have a one-stop shop to be able to address all these different areas, because for them it doesn't matter. They want to do something, and so going to different places to do that is often an impediment. Generally, jurisdictions that had expanded access to supports during claim adjudication found, although they hadn't formally evaluated it externally, but their own internal evaluations that found that they thought that there was a real value in that. So expanding access, getting people in touch with, it doesn't have to be a psychologist or a psychiatrist. So someone with a diagnostic capacity could just be could be a social worker or some other supports for them to start to discuss the issues, discuss what the challenges were, and expanding the access to that. So not just to the worker, maybe also to family members who are helping them in terms of the claim adjudication process. This continuation, so continuing to invest in specialised teams. So there are ways in which psychological injuries and even addressing the psychosocial work environment is a little bit different to what we traditionally think about in terms of the physical environment. So trying to understand the creation of a specialised team, using trauma-informed approaches. So I talked about that before around, as part of the claim adjudication, it's not helpful around, especially for psychological injuries, to keep recounting the event to multiple different people as part of the adjudication process, because that can re-traumatise people. And so finding other ways to navigate that. I'd have to say this because we are a research organisation, but there was a real need to invest in evaluation and evidence generation independent of the agency. So collecting common indicators across jurisdictions, having shared prevention and management outcomes that all jurisdictions would collect and would be independently collected to evaluate system performance and interjurisdictional performance. And in particular in Canada, so a lot of the interjurisdictional inconsistency in Australia has been taken into account with Safe Work Australia and having a shared approach to sort of codes of conduct across Australian states and territory. And I think there's a real opportunity. While we're focusing on breaking down interprovincial trade barriers, there is a real opportunity here to harmonise our approaches around all sorts of health and safety activities, but it would be particularly useful to do it around psychological injuries because there is a lot of variation in that space. For more information, we do have plain language summaries of this on our website. These we put into the chat. We also have a project report on this particular project. That's it for now. I'd be happy to take questions. I'm sorry I went a little bit over, but my contact details are here. Thank you very much. Over to you, Monique.
All right. Well, thank you, Peter. It's going to be back to you in just a moment. We have a number of questions. That was a really fascinating and informative presentation. Very much appreciate it. Just to remind you, the slides and the presentation will be available in about a week, so you can get those. As I mentioned, we have a number of questions. I'll try to answer them in the order that they've come in. If we don't get to your question, please feel free to send it to Peter at a later date. And I know we have some people who have joined us on YouTube, and unfortunately, you won't be able to ask a question. But again, please feel free to send your questions or comments to Peter. All right, let's get started, Peter. The first question is a little bit of a two-parter. The individual is asking, what public health measures has Australia instituted to support employers and employees with pre-existing psychological conditions so that employers are not being held responsible for those pre-existing conditions with respect to psychological claims? Well, I'll stop there and let you answer, and then I'll give you the second part.
Yeah, so that's not an area that we specifically explored in this project. We weren't interested in, not that we weren't interested, but this particular project was trying to understand around sort of the approaches to the psychosocial work environment and I guess how employers might address that in terms of the claims. I will say that, you know, one of the things we heard, and I sort of alluded to this a little bit in the presentation, was there was a lot more benefit, and a lot of people in the Australian jurisdictions sort of focus on this, at getting employers to focus on the psychosocial work environment rather than the mental health of their employees, because there was a recognition that your employees' mental health involves a lot of different factors, a lot of different areas. As an employer, you don't have control over all those areas, but what you do have control over is the work environment, and you can take steps to sort of measure and understand aspects of the work environment that might be associated with the exacerbation of conditions or the development of new conditions, and addressing those factors. And you should be doing that as part of your duty of care when it comes to your employees in the workplace. And so, as I said, I guess not much of an answer. I've sort of skirted around the question, but it just wasn't something that we specifically addressed in this study.
Okay, I will ask the second part of the person's question, knowing that with just maybe something a little bit different then. Particularly for small employers who perhaps then want to address some aspects of the psychosocial work environment. Did you hear about any efforts that any jurisdiction was taking to try to help workplaces to address perhaps someone who might be more susceptible to stress, or what they could do in their work environment?
Yeah, so we did hear, so small businesses came up, and sort of challenges around small businesses. Actually, in particular, one of the more interesting things that came up around small businesses is that we often focus a lot on the employees of a small business, but don't actually focus on the owner operator, and they're under a huge amount of stress. But all the resources we direct at them is on how they can help their employees, and not on how they can sort of help themselves. Sorry, I digressed just a little bit there, but so that often came up as issues, and the challenge of addressing small businesses, and, you know, sort of how you could make that meaningful. I don't think we heard from a jurisdiction that had sort of successfully managed to navigate that challenge. So had successfully managed to sort of say, oh well, we know sort of the solution to small businesses. We did hear a lot, and I think there's, again, opportunities here in Canada and in Australia for different. So in both countries, workers' compensation and prevention activities are often done at a state and territory level, and there is a little bit of informal conversations, but not a lot of sort of general conversations. And so sometimes we'd heard, you know, that in a particular jurisdiction they were doing some work. Like, oh, do you talk to anyone else about that? And they'd be like, no, not really, or we haven't had an opportunity. And so, again, I know I'm not answering this specific question, Monique, and I've actually forgotten what it was, but I do think there is opportunities for greater collaboration across jurisdictions and sort of harmonization of approaches across jurisdictions, and finding out, having jurisdictions in particular talk to other jurisdictions about what didn't work. Because we're pretty good at talking about what works, but we don't often talk about, you know, we went down this path and it didn't work at all. Don't do that. But I'm sorry, I know I didn't answer that question.
No, that's okay. We'll go on, because I think these issues are going to emerge also with some of the other questions.
I encourage that person to email me, and I'm happy to take that conversation up.
Okay. Thank you. You mentioned that Safe Work Australia created a national standard. What organization, if any, is the equivalent here in Canada?
So it's a national code of conduct,
Okay.
and they found that actually one of the interesting things when we spoke to we spoke to Safe Work Australia was they found codes of conduct. I don't know, they had just found that they tend to have better uptake in terms of naming it a code of conduct. Um, so, I think in terms of, is there a similar organisation in Canada? There's not one, I think, that actively. So in Canada, we do have the standard for
Mhm.
psychological health and safety in the workplace. I think people have weighted that standard. I know the standard's currently being revised. I've also given some feedback as part of that revision process. So I guess the standard for psychological health and safety would be similar. I think the difference, and again, I don't know a lot about how the psychological standard has been developed in Canada. Safe Work Australia, the difference is it sort of brings all the compensation and prevention authorities together to develop the standard, as well as other interest groups. I don't know the extent to which the development of our standard in Canada has done that. So I guess the standard, I think there's a role here. So I think organisations like the Association of Workers' Compensation Board, which brings together the provinces and territories, they could play a role in sort of developing this type of guidance. I think, as I said, the variation is a big issue in Canada. So if you're an employer in Ottawa, depending on whether your employees are employed on one side of the river or the other, you've got completely different standards and legislation. Now, that's an issue. If you're at the border of any of the Atlantic provinces, you've got different situations. And so, while I'm sure we probably don't have the Prime Minister on the webinar today, but if someone who knows the Prime Minister is on, I mean, while we're talking about harmonisation and while we're getting people together to talk about harmonisation, let's talk about how we harmonise guidance material, how we harmonise what sort of injuries are included across jurisdictions. I think that would be a great start, so that an employer, regardless of where they operate, can use the same guidance.
Okay, I don't know the Prime Minister, but thank you for that
He's a
outreach to
runner.
everyone. um, Are there, you gave some examples in your presentation. Are some of these examples and others of best practice case studies available online that you know of?
So the ones that I include in the presentation are, so the smart work design, I think that is available. If people want to contact me, I think if you go to the report, I think we do specifically mention it in the report and provide a link to that information. I think one of the things, and I know I sound like I'm talking like someone who leads a research organization, which I do, but there is a real opportunity here to strengthen collaborations between prevention agencies, workers' compensation systems, and research centres, like not just including the Institute for Work and Health, but like the Institute for Work and Health, so that we can better generate evidence around what's working and what's not working, and have sort of more rapid cycles. I do think research organisations like the Institute are really open to these types of rapid evidence cycles, and I think we need to use more of them. So if someone is on the call and wants to sort of push this agenda along, my contact information's here, and I'd love to have that conversation.
Excellent. All right. Next question. In your environmental scan, did anyone surface the theme of how psychological hazards are defined? Physical, chemical, even biological hazards are generally pretty easy to define. Psychological hazards, however, do require some degree of interpretation of the behavior of other people. So can you speak to that a little bit?
Yeah. So again, I think one of the things we observe, so in Australia, so Safe Work Australia has this code of practice where they list psychological hazards, and these are sort of the general ones where there's sort of an evidence base, and things like job control, job demands, psychological demands. I do think so I guess I'll say two things. So one, Safe Work Australia are cautious that they say it might include these. So they're not prescriptive. They're not saying these are the ones you need to care about. And they also note that in your organization, they sort of describe them, but they're like, in your organization, you might call it something completely different. Like you might call it grant pressure, which is, psychological demands or emotional demands. So then there's that opportunity to say, we're just going to describe them, but it's your job to talk to your employees and figure out what you want to call them and how you might address them in terms of your organization. My second point was, it's left me, but I might come back to it in terms of something to do with psychological guidance material. It was, no, sorry, it's gone again. Sorry,
Okay,
Monique.
well, I'm going to give a second part to this question, so maybe that'll also bring it back because, in terms of this degree of interpretation that people have around, other people and in what is a psychological hazard, the individual notes that sometimes they feel that what is happening is that a workplace is often defining, looking basically at specific people. It's the person that has the issue, not the workplace that has the issue. Can you comment on that?
Yep, and I did remember what I was going to say. So I can comment on that. So we did find that in Australia, the coverage for, I guess, chronic mental stress has been in place for a couple of decades. And so I think they're a little bit further along in terms of we've tried this and it didn't work. And consistently we heard across the Australian jurisdictions that things around trying to treat the individual, build resilience, were not successful and took a lot of resources, and that wasn't going to be effective. And which is one of the reasons that I was sort of talking about this distinction between the psychosocial environment, which is about the structure and organization of work, is what they want employers to focus on. And they want to build capacity about how employers can do that rather than building resilience among employees so that they're just a bit hardier to the same things occurring over time.
Mm-hmm.
The other thing I wanted to note, which dropped my mind before, because you were describing how sort of things like chemical hazards and physical hazards are well defined. So two things to note there. One, there is an increasing recognition, and this is currently in the international standard for psychosocial work. I've butchered the name, but the ISO standard. Physical risk and being worried about getting hurt at work is a psychosocial hazard. And that's something you need to take care of at an organization. In fact, when you worry about work, the outcome, and we saw that, right? If you don't address the physical work environment, things get a lot worse than if you do. So I think that's, again, something you want to take into account when you're sort of thinking about those environments. That end, we did hear when it comes to helping workplaces address sort of psychosocial hazards in the workplace, the approach does have to be a little bit different. So you don't go in, with a noise monitor and say noise is too high here, put this in place, or dust is too much here, put this in place. It is a much more, and some jurisdictions actually had different areas which were to doing the psychosocial safety inspections, because it is much more around guidance. So have you assessed psychosocial hazards? Do you know where to start? What sort of activity can we help you about things that other organizations similar to you might have done and how they've looked at that information? Can we, again, shameless plug for the JDAP, can we provide you with solutions that are no-cost solutions, which I think is one of the things that the JDAP does really well.
Okay, thank you. So I'm going to try and get in a few more questions here before the hour. Does your research lead you to conclude that it would be best to combine those jurisdictions that currently have a separate claims management entity versus a prevention entity? And if so, why?
Yeah, so we haven't done a formal evaluation of what works best. All we found is that sometimes when the roles were split, there was an additional challenge around communication across organizational silos. Not to say that large organizations don't have similar challenges just communicating across organizational silos, but it was just sort of noted that when a prevention system or a prevention authority is charged with, say, enforcing legislation around bullying, harassment, say in Ontario, bullying, harassment, violence, the guidance material tends to be focused on the legislation. And to go beyond that creates challenges because employers now get confused around, I don't know, is this legislative requirement? Is this going beyond? And so I do know in Ontario and in many other jurisdictions, we're trying to get organisations to move beyond compliance. That's a big sort of push. at a system level. But we need to think about, so how do we message that to organizations? How do we give them, so yes, this is, you're compliant, but if you want to go beyond, this is what you need to do. And so that's, again, there is no clear answer as to what system works best and why. But as I said, the more barriers we create around physical, psychosocial, compliance-based guidance, non-compliance-based guidance. I mean, it's confusing for workplaces. Even the best intentioned workplaces can get confused about where all the information needs to be.
Right. Thank you. That was very helpful. You may want to, answer this partly. An individual is saying, did your research indicate that Ontario's WSIB was more of a reactive organization rather than a proactive one in terms of managing psychological claims? And what approach does your research indicate would be best for it?
So we didn't specifically look at what's happening in Ontario. I do know, so for example, the WSIB does have the Health and Safety Excellence Program, which is more of a prevention focus program. And that program has recently, I'm not sure exactly when, but I know over the last couple of years, has introduced particular modules around the psychosocial hazards in the workplace. I do think in terms of, I guess, on one level, it makes sense to have both hands knowing what the other hand is doing. So, often when the roles are separated, you can lead one agency to focus on the most common type of claim, but not the most costly claim. But even when they're together, you might have the reverse happening, where if compensation and prevention are combined, you might focus on the most costly claims, not the most common. So I don't think there's a right answer here. I think it's just trying to understand, when they are siloed, here are the additional challenges you might need to take. But again, when they're together, it's not like when we spoke to, like in BC, when they're together, it's not like they were like, oh, and that solved all our problems. So I don't have a definitive answer there. It's not, but it's an area where we should, do a little bit more work about how can we focus more proactively. Because talking about the thing I did before, I mean, the best thing you can do to improve your psychosocial work environment is have a good psychosocial work environment. Because when you've got a good psychosocial work environment, everything else you do, people trust you. People, there's a shared understanding of what needs to happen. And so, things around addressing job demands, around addressing stigma, work best when there's management commitment and employee participation. So you kind of need a good environment to make changes. And that's, I think, one of the consistent challenges that we heard about, is that it's often too late. People have this large volume of claims, chronic stress claims. They don't know what to do. And there's so much that needs to be done. You're really just putting Band-Aids on the solution. And so it'd be much better to be more proactive. And I think, I'd say even in Ontario, I think the WSIB does have a more proactive prevention arm at the moment. And there's value to that.
Okay. We have about a minute. Well, let's just
Yes.
follow up on that. So, considering the importance of management commitment and worker participation, what are your thoughts on trying to assess organizational readiness for change prior to implementing a psychosocial assessment? Are there ways that we can kind of assess some of this?
Yeah, so I think the PSC 12, so the Psychosocial Safety Climate 12, which is the tool that I presented a couple of bits of information on, is a measure. There is a license on that measure with the American Psychological Association, just as a caveat. But that assesses things like management commitment, and it's done at a worker level. Like, do they think that management's committed? Do they think there's good communication? Do they feel like they can participate? Do they think psychosocial stuff is a priority above productivity? These are all things you don't need the PSC, and Maureen Dollard would probably hate me saying this, but you don't need the PSC. I've just sort of described what you want to ask. But I do think before you start prescriptively putting in place changes to processes, it makes sense to say, we're committed to doing this. We want to hear from you in terms of the employees about this. And we want to involve you in what's going to be feasible from our perspective and what's going to be effective from yours. And that's just good practice, regardless of the hazard you're focused on.
Okay, that's fantastic. And I'm sorry we don't have more time to answer more questions. So please do send questions and comments to Peter. Lots of good comments, Peter, on the presentation and the material that you've been presenting. Thank you all for joining us today. I hope you'll join us in a month on June 23rd when we have Dr. Faraz Vahid Shahidi, who will be speaking about parental employment quality and the mental health of children. So thank you again, Peter, and thank you everyone who joined us today.